The use of antidepressants in dementia patients has long been a topic of debate, with some studies raising concerns about potential cognitive decline. A recent study from Sweden suggests that dementia patients who take antidepressants may experience a faster cognitive decline than those who do not. However, the reality is far more complex, and this research should be interpreted with caution. The study does not establish a direct causal link between antidepressant use and worsening dementia symptoms, nor does it consider the critical role these medications play in managing depression and anxiety, conditions that can severely impact the quality of life in dementia patients. Dementia is more than just memory loss. It affects sleep patterns, emotional regulation, and motivation, often leaving patients isolated and overwhelmed with fear about their deteriorating cognition. Approximately 40% of dementia patients experience significant psychological distress, including depression and anxiety. While non-medication therapies such as psychotherapy and physical activity are the first recommended treatments, these are not always effective, particularly in advanced cases. When these methods fail, antidepressants are often prescribed to help stabilize mood and reduce anxiety. The Swedish study examined 18,740 dementia patients and found that those taking antidepressants, particularly selective serotonin reuptake inhibitors, SSRIs, like sertraline, showed a faster cognitive decline compared to those who were not on such medication. Interestingly, another antidepressant, mirtazapine, appeared to have fewer negative cognitive effects. However, leading experts in dementia research argue that these findings should not be misinterpreted as evidence that antidepressants cause cognitive decline. Instead, it is possible that patients who require antidepressants are already in a more advanced stage of the disease, and their worsening symptoms may be a result of dementia progression rather than medication effects. Other studies have even suggested that antidepressants may have protective effects against cognitive decline. A 2017 study published in the American Journal of Psychiatry found that SSRIs could slow down cognitive deterioration in dementia patients. This highlights the complexity of the issue. While some research points to potential risks, others indicate possible benefits. This conflicting evidence underscores the importance of personalized treatment approaches rather than a blanket rejection of antidepressant use in dementia care. Depressive symptoms in dementia can have devastating consequences. Untreated depression can worsen cognitive decline, increase agitation, and significantly reduce a patient's overall well-being. Given the lack of universally effective treatments for dementia-related psychological symptoms, physicians often face difficult decisions when prescribing medication. The reality is that many dementia patients struggle with severe mood disturbances that can make daily life unbearable, not only for themselves but also for their caregivers. Without appropriate treatment, these individuals may suffer unnecessarily, leading to increased distress and a greater burden on families and healthcare providers. The findings from the Swedish study should serve as a call for more targeted research rather than an outright rejection of antidepressants in dementia treatment. There is an urgent need to refine treatment strategies, ensuring that patients receive medications that provide the greatest benefit with the least risk. Healthcare professionals must carefully weigh the risks and benefits of antidepressant use, considering alternative medications like mirtazapine or exploring non-drug interventions where possible. Doctors and caregivers should also focus on comprehensive care strategies that include cognitive stimulation, social engagement, and lifestyle modifications to support dementia patients. Regular monitoring of antidepressant effects is crucial, and any signs of worsening cognition should prompt a reassessment of the treatment plan. Additionally, patients and their families should be informed about both the potential risks and the benefits of these medications, allowing them to make educated decisions alongside their healthcare providers. While concerns about the impact of antidepressants on cognition should not be ignored, the broader picture must be considered. Depression in dementia patients is a serious issue that requires appropriate intervention. Rather than discouraging the use of antidepressants altogether, medical professionals should focus on individualized treatment plans, selecting the most suitable medication for each patient. Further research is needed to clarify the long-term effects of different antidepressants on cognitive function, but for now, denying patients these medications based on inconclusive evidence could do more harm than good.